So welcome everyone. Good afternoon. And I am Anne Marie Healy. I'm the Executive Director for a private foundation here in Philadelphia called Philadelphia Health Partnership. And my colleague here, Heather Major, who's the Executive Director for IDX Foundation. And then next to her is Meredith Poland, the Senior Officer from Hugh Traffic Trust. And our third panelist is on her way, and she's the Senior Policy Advisor for Robert Wood Johnson Foundation. And so we want to make sure that we're capitalizing on everyone's time and being respectful. So we're going to kind of jump right in. So I have to say, it's a real pleasure to have the three or four of us represent philanthropy in this room here today. Because we do often serve as a bridge between public and private, between community-based organizations, government, etc. So it's a really great honor for us to be here. And so today what we're going to do is talk about our shared perspectives on fostering collaboration and coalitions and driving community-focused initiatives through data. And then along with public and private sectors, philanthropy relies on and utilizes data to inform its strategies, including data-driven design of programs and interventions. And we also engage with community members, such as grant seekers, as well as granting partners. And we also use data for outcomes and evaluation. Not very different from, I'm sure, everyone here in this room. So often foundations can also provide those tools and those resources to grant seekers and partners through training and expertise on what data sources are important and useful and how to use them intelligently and responsibly. I have yeah, we had your comment in the back door. So perfect timing. So I'm going to just jump right into the panelists, and ask first Heather to share IDX's project with HSX and how this can lay the foundation for future scalability through leveraging social determinants of health data.
So I represent Independence Blue Cross Foundation. For those who don't know us, we are the regional health foundation of Independence Blue Cross. I think you'll probably recognize that branded name. And what's really special about the work that we do is we are really here to live out our company mission in our community. We focus on improving healthcare access, strengthening the health workforce, and solving for better community health. So where does health share exchange fit in? Probably in any one of those spaces. But our specific project with them is really around leveraging the health information technology platform that they've created with our hospital systems and moving that into more community-based care. And it was something that we've been thinking about and wanting to work on for a very long time. There are other states that seem to be a bit ahead of Pennsylvania in terms of how to use and connect data through health information exchanges with community-based organizations to address social risk management as part of clinical care. But Pennsylvania's, we're there. We're on the map, we're there, we're doing the work. And so we have a really great project underway for seniors who have diabetes. And leveraging that information and data through the health information exchange technology is an outstanding project to make sure that we're not only closing clinical care gaps and needs, but that we're also addressing the social needs of patient populations. And hopefully before those become problematic in their social or clinical sense. So who are we working with, I think is a really important question. We're really trying to move this into the community space, and one of our largest stakeholder groups and most trusted partners is the health center that we work with. So we work with federally qualified health centers, free clinics, and nonprofit clinics. They are a cornerstone of this project and this work. We're also working with areas of aging and, of course, other community-based organizations. The way I like to describe this to anybody who's not in healthcare is if you walked in the doctor's office and had anybody give you the social determinants questionnaire, and I once had an MA say to me, where does this go? Like, what do they do with this information? Okay. I'm probably not the right person to ask, but at the same time, the right person to ask. It goes into your file, right? And it probably doesn't go anywhere, to be realistic. But now there's a place for it to go, right? That information can now be passed along through this information exchange to make sure that there's a network of providers and a network of community-based organizations that are able to easily exchange information both ways so that the patient remains at the center and the supports, resources, and assistance in clinical care is delivered to that patient in a more holistic manner. I know we talk a lot about infrastructure, but I really think we need to be thinking about what digital infrastructure is, and I really think this represents digital infrastructure in healthcare. It's going to be really hard to move our industry and care and costs forward in the ways that we want to if we're not leveraging technology. We can't keep adding to a workforce. We can't keep advancing technologies, but adding to a workforce, increasing costs, and not having a way that we can make this more efficient for many more people than it is today. So that's the basis. It's called Nests, and I know it was reported on today at the board meeting. I'll defer to our HSX colleagues on current results and successes, but the plan is to figure out who else and what's next for Nests. So older patients with diabetes is a very specific patient population, but arguably one that probably has higher rates of readmission, all sorts of challenges with food, transportation, not just healthcare. And so we're going to be working with them hopefully for a very long time to keep these demonstration pilots and projects going and figuring out who else can we reach in the community, and building on the success of one pilot, I think really creates the momentum to do this. And as we said earlier, let's scale this across the state. And I think that there's a real opportunity here to use private funding to help that for public good. I'll just make one comment about data because I'm a real practical person when it comes to data. You can't escape it. You have to know what kind of data you have, how best to use it. So from our funding perspective, we use data in three ways. Data is really how we develop our initiatives. So if you're, I don't know how many nonprofits are here today, but we don't want you to spend the time telling us about a need that we should already know about, especially in healthcare. If we're not reading and doing our homework, then we're really not the right funder. You don't want to work with us. I can assure you, we do a lot of reading, we look at a lot of common data sets. We want to come into conversation sort of level where you are in terms of your knowledge and understanding. But we do use data to develop our initiatives. And that was part of the comment that Anne-Marie made earlier around data-driven design. It's really important to get the design right because then the outcomes will follow. The results will follow. So that's, to us, that's called fit. So if you can meet the fit, we're having a conversation. The next is that we actually use data to determine the level or amount of funding, and that is a formula, really. And it's not all formulaic, but it is a formula we use. There's no mystical nature to any of it. It's actually very methodological. And to some that might be boring, but to us it's really important because it's part of our fairness, how we award dollars. And then the last thing that I will leave with you about data as it relates to the work that we do at Independence Blue Cross Foundation is we actually want to use data to understand value as much as we want to understand results. So what is that? How does that work? You have to tell us, nonprofits, or anyone that we're working with, what the value of our investment is to you. So if you think about sort of the gold standard of all funding, which is unrestricted, use it for whatever you need. The purpose of unrestricted funding is to actually build organizational capacity. We talk a lot about keeping the lights on, paying overhead and all those things, but it's really about building your organizational capacity, being able to continue to deliver your mission in the way that you need to do what you need to. And why is that important? Well, we once did a large-scale assessment of all the health centers in our region that we fund. There are 65 different sites that we support annually. And what they told us was for every dollar we give them in general operating support is $1.25 in value to their organization. That's quantifying value. That's different than results. We expect a result, we expect to report on them, we expect you to put them in your grant application. What kind of results do you think you're going to have with this funding? But value is something that is incredibly important. And only you, the nonprofit organizations and the leadership, can tell us what the value is. That is not data that anybody else has. And I would encourage that when you're thinking about data and you're thinking about collaborating and data design initiatives, really know what you're bringing to the table as much as you know about why you're asking for the funding. So data plays that role. And for us, that's called potential. So it's fit, formula, and potential. And those things are really important when we're assessing the opportunity for a partnership. So when we, had the unique opportunity to sit down with HSX on a health information exchange, one, I think everyone knows I was excited. Two, we want to solve great problems, but we also want to create opportunity. And I think that's what, in essence, aside from all the details and the hard work and the great, technologies that already exist through HSX and the platform and the willing partners, that's a lot of things that have to go right. I do think that this is solving both for a problem and creating greater opportunity.
So that was actually a great segue. I'll talk about opportunities. So Kathy, do you want to take it next? So interested in sharing how HSX data repository has been useful for the Robert Wood Johnson Foundation work.
Sure. Hi, everybody. Sorry I'm late. I'm Kathy Hempstead from the Robert Wood Johnson Foundation. And Robert Wood Johnson is a national foundation, so we do some local stuff. We have sort of a broader interest. We're primarily a health and healthcare foundation, but we think about health very broadly and, fund a lot of things like community development, housing, lots of other things. So we're not strictly in the healthcare space. I myself do most of my work on sort of coverage and healthcare policy and healthcare costs. So I thought if I could just back up a tiny bit, I'll get to HSX, but I'll talk a tiny bit about how we use data at Robert Wood Johnson Foundation, especially some of the projects that I've been involved with. It's a very large foundation. We're certainly not involved in everything. And before I came to Robert Wood Johnson Foundation, I ran the Center for Health Statistics in the New Jersey Department of Health and Human Services. So I came there loving data and being really interested in data and wanting to try to find ways to use data in new ways in philanthropy. And Robert Wood Johnson Foundation has a lot of really well-known data-related projects like County Health Rankings, for example, which sort of packages public data and parses it out to small geographies and lets people see, variations in life expectancy. And those are, sort of great projects that help make people aware of inequities and different kinds of things and opportunities for improvement. The kinds of projects that I've been involved with are, I would say, more designed to take data that's really in the private sector one way or the other and make it available for mostly non-commercial use, although sometimes commercial use is sort of part of the idea. But I'm primarily interested in making data available to four key audiences, which are researchers, and they're not in order of importance, by the way, researchers, advocates, journalists, and government. So those are sort of the groups that I'm trying to reach with the data projects that I do. And the second thing I'd say is really the goal for most of what we do is to drive policy change, to assess how policies are working, to think about how policy change might make a difference. So there's usually some kind of policy approach to most of the things that we're doing. So just like a couple of, for examples, because did you work? Okay, yeah, I don't want to. So, when you come in late, you have to not suffer all the time. So, we've done a bunch of work around the Affordable Care Act. I came to the foundation right when the Affordable Care Act was just sort of rolling out and being implemented. So one of the first things we did was we created a partnership with sort of an insurtech type firm and created a public-facing repository of plan data about the ACA called Fix Compare that we made available to all users, commercial and non-commercial users. And it ended up, I think it still is, pretty important that lots of people use it to figure out what plan designs look like, who's participating in different markets. We integrated all 50 states before the CMS really got it together to pull in the state-based marketplaces. And still, CBO uses our data in our simulation model, and I think it's been a really helpful way for market participants, advocates, other people to understand what's going on with the ACA. And we also made certain more commercially valuable parts of that data available for non-commercial use at no cost. It's sort of by specific requests. So, for example, we made formulary data available for non-commercial use. When people describe their non-commercial use, they didn't have to compete or describe a project or be rated on the merits, but it just had to be a valid non-commercial use. So, advocates were able to look at whether plans for adversely tiering against certain medications in certain markets and, other things like that. And we also made provider network data available at no cost for non-profit. And created a few different opportunities with that so that people can look, for example, plans that are in both Medicaid and ACA markets. How do their provider networks differ, and if at certain points, like say during Medicaid unwinding, there's a lot of conversation about people moving from one market segment to another and staying in the same plan. Maybe what happens to the provider network? So these are the sort of kinds of questions that that people would like to answer. So there's sort of a bolus of marketplace work that was done by sort of putting data out there into that sort of Then I'd say another category is cost work. So we funded HCCI a long time ago when it was sort of an early stage organization. Unfortunately, we don't fund it anymore. We still did. But foundations have short attention spans. I don't, but they do. And that was back when United Health was really providing all the data for them. So that would be health intelligence. But that was really, really influential research came out of HCCI that helped put some of the issues about hospital pricing variation on the map. I go and talk to a lot of hospitals here. So, there's two sides to the issue, but it was certainly an important conversation to have. And then we funded the RAND project, which was another, I think, exercise that took data that was really employers data from their self-insured plans and priced it in terms of Medicare and, created some important information about variations of what employers were paying. So that's sort of another category. And now I'm kind of getting up to where HSX comes into the picture, because HSX has been a really, really important partner. So, after a while, we decided to create sort of an opportunity where we recruited a bunch of really rich, valuable, exciting data sources and create sort of a competition, a competition for people to apply to do different kinds of research projects with these data sources. So we worked with HCCI at the time. We worked with Athena Health back in the day. They were very interested in having their data used to let people understand what was going on with the ACA, what was happening with coverage change in people's use of primary care and different things like that. And we worked with Optum Labs a long time ago. And pretty early on, we were introduced to HSX through a friend of mine, a former colleague of mine at the foundation. And that's a phenomenal data set because it's very, very, very representative of a really solid part of geography. So there was a ton of researcher interest. And so we created this program that was called Health Data for Action, which was a round of competitive proposals where we stood up a panel of data sources of various kinds, and we did 4 rounds of it, I believe, in HSX. I think the first round was very small, but HSX participated in that, and every round got bigger, and we recruited more and more really, really interesting data suppliers, and people were surprised at both not so much by the demand, because we knew there was a lot of demand for this kind of data because it wasn't, commonly available, but that how many different kinds of organizations wanted to make them available for non-commercial use. So I do think that there's there's a huge market there, and we sort of always felt as though we were putting up a kind of pop-up store and having this opportunity and shutting it down because we ran out of money and awarded the grants that they awarded. But I do think that there is, a really big demand, both on the supply side and the demand side, for people who work with really, rich data on claims or, EHR that's just not commonly available to researchers. And most of these projects were for research that had been going into the peer-reviewed literature. So we had a number of rounds of that project. We included EPCDs from states that had them and other sort of EPCD lookalike type data sets that states had. We worked with Geisinger a few times. I mean, it was really fantastic. So that was a great project. And one of the things that we were also interested in doing was seeing how you could use, quote unquote, real world data for surveillance and to see whether we could improve timeliness. We had a obesity program, and we relied on the CDC's NPS survey, to look at child nutrition, BMI trends, and it's very lagged, very small sample sizes, hard to look at geography, hard to look at race ethnicity. So I ended up being able to use some of the money on the obesity proposal to see, could we use this data to do sort of, accurate and timely BMI surveillance. We worked with HSX on that and a number of others. And it was, we actually partnered with CDC because, government was always one of our audiences to see, should you be making more use of government of real world data and rather than relying exclusively on these very expensive and sort of slow moving surveys that usually we're using. And so that was another great project that I'm actually interested in trying to again. And I guess I just wrap up by saying that I'm always looking for new ways to use data to kind of address policy problems. So if you have an interesting idea, please let me know about it. But I'd say kind of right now, what we're interested in doing is using data to try to, first of all, kind of make people aware of the implications of certain potential policy changes, like, for example, the lapse of the expanded premium tax credits in the ASA marketplace. So we are using the exclude air data to show through the congressional district level how much premiums will go up, and we're sharing that with advocates that are, trying to make the case on the Hill that this is really important, and that even if you buy that to a Bronx plan, you're still going to spend a lot more money and have a lot more pressure, and then the other thing that we're interested in doing, and this involves HSX, I hope, is to try to see in these times, it seems important once again to kind of think about using real world data to do surveillance. If we, maybe want to look at trends and things like child vaccination rates or, vaccine prevalent diseases or other kinds of health measures. So we are looking at ways, and the foundation is very interested in seeing how we can do what we can to build data gaps that that we open up short, medium run. And so that is another way that we're really interested in different sources of data and HSX is important. So that's kind of what I believe also.
Thanks, Kathy. So next is Meredith's going to talk a little bit about Pew and their approach with collecting and using data. I think many people in the room already know that Pew has a research arm, and you probably have read many of the reports. So not only is Meredith going to briefly talk about how Pew uses data as a philanthropic organization, but also how data is used by nonprofits. So I think that that's a really key piece here is, we talked about philanthropy being that bridge, but how does the nonprofit sector, the community-based organizations really use that data? So,
hi everyone, I'm Meredith. I'm from Pew, and most of you might know Pew for the work that we do with NPR. You might know us for a lot of the research that we do. The other piece of work that Pew is known for here is this is actually Pew's hometown, and I work for the team that is responsible for grant making to health and human service providers in the Philadelphia region. We provide about $12 million to organizations in this region. I'm happy to see Nana is here. They're one of our growth grantees. And we fund under two programs. One is our growth portfolio, which is really meant to help organizations scale and to serve more communities. And the other is our portfolio that's focused on filling service gaps and on accelerating innovation. I think just to start, there's one important point that I would say from Pew's side, and I think from most people in philanthropy right now is that with all of the cuts that are happening at the federal level, philanthropy cannot make up that difference alone. It's just not possible. As I said, we put out $12 million, that's really a drop in the bucket compared to what a lot of the government sources provide here in the region. So I say that to say that a lot of our CBO partners right now are really having to think differently about how they do their work and how just really thinking critically about the types of supports and services that they need to offer to support communities and clients through a really tumultuous time for many of the types of communities that we serve. So just wanted to make sure that we started there. The other part of work that we do in Peru and Philadelphia is that we provide organizations with what we call beyond the dollar support. And that's really through thinking more broadly about what we call sort of capacity strengthening. So how can we help organizations become better at what they do and to serve clients in ways that are important to clients and to those communities? And we do that in a few different ways. I'll say that in all cases, evidence and data really centers the work that we do and is really critical to the work that we do and has been very important to Pew for the past 75 years. I think what's been really interesting is that the definition of data and evidence has really shifted over the past few years and has really been expanded to make sure that it is really rooted in what communities want to see, what impact they want to see the organizations that work with them to have, and that it's really centered and on that as our main focus area, which are the communities. And I think we're moving more from what we have traditionally called burdensome and audit-centered ways of using data to ways that are engaging community and that really also engage policymakers as well as researchers as well. So I just wanted to sort of just provide that brief overview. I think another important piece to really think about and consider related to data is that data should not do harm. And we really take that seriously in how we think about our work and our work with our nonprofit organizations. We take privacy very seriously. And as the earlier panelists had talked about, with the advent of AI and what we're seeing happening with AI, it's really important that our nonprofit partners are really kept up to speed and also being able to develop their expertise related to AI as well, because we know that's going to help them be more efficient in how they serve communities and how they serve their clients. And in this time where there are more resource constraints, that's really an important consideration for all of our organizations and for them to be able to serve our communities fairly. In terms of what it's meant for HSX and how we can sort of think about the use of the data, I think there's a few different ways. I will say Pew is really thinking about, in terms of funding for the next few years in Philadelphia, around economic mobility and economic stability. And what does that mean? And I think one of the key pieces that we're really unpacking and thinking about and learning about is just where health comes into play and how important health is to economic stability for a lot of the families and communities that we serve. So just really understanding the health disparities and understanding, what that means from a geographic perspective, and then how we also think about prioritizing funding to our nonprofits based on what we're learning through data. And the other important piece I'll just mention is really around evaluating program impact. Again, with Pew and with us sort of being really focused on data and evidence, we want to make sure that the organizations that we are supporting are able to be impactful. And we look at a lot of the data that they provide, not from a punitive way, but really to understand what that impact is, to understand where organizations can share what they're doing with other organizations as in terms of best practices, where they might be able to solve problems collaboratively. And again, just knowing where the resources are going, it's going to be even more critical and important that organizations think about collaborating as they move forward.
Can I ask another question, or Marty, do you want to?
No. You ask yours, then we'll.
Okay. All right. So when we had our prep meeting, and our previous panel was talking about federal funding cuts, policy changes, kind of a moving target, etc. We had talked about during our preparation for this panel, talking about the question of during this time of uncertainty, what are some of the ways that your foundation is prioritizing, not prioritizing, shifting, pivoting, and response. So just kind of want to get your insight on, this changing environment and what actually is happening within your philanthropic organization.
I'll be short this time because it's a really nice, easy and straightforward answer for us. So at Independence Blue Cross Foundation, we actually award about $10 million in the five-county region of Southeastern Pennsylvania annually. If you know anything about our investment portfolio, we're not that big. So we are giving above our IRS minimum 5%. We've historically, and we're going to continue to do that. We have a great board of directors. They're highly engaged. They champion our work. And it's really important to our company that we're not just living our mission for our members, but that we're actually living our mission in the communities because this is where we work, live, and play. So that's first and foremost, is that I know there's a lot of talk in philanthropy around whether or not organizations are giving their minimum or above. We've historically always done that, and we'll continue to do that. I think that, as expressed earlier, our focus and our grant strategies aren't changing. The majority of our portfolio is general operating support, scholarship, and then project-based support in that order. So that's not changing, and nor are our focus areas. I think then, we talked about this earlier, I don't know what I shared that you wanted to ask this question, or revisit this question. Oh yeah, that's it. That's it. It was that simple. And only to say too that just from a philanthropic perspective, there's a lot of information that goes into our decisioning and a lot of information that doesn't. And so I would just say, just sort of as a blanket statement, not everything is a point of consideration. And I'll leave it at that.
Yeah, and I would say at Pew, we're staying our course, and I think, and we're also monitoring what's happening, right? Because things are shifting so quickly, and sometimes it's hard for us to even understand what is happening, what is the impact of that, and what does it mean? So I think that's one piece we're really just paying close attention to. I will say one thing we're trying to do to support our nonprofit communities is get more support and services out to them. So we actually have been offering some additional supports around scenario planning, helping them think about, so just understanding that the funding cuts, where are they, where are their decisions that they need to make, what programs should they consider continuing, which ones should they potentially think about collapsing or merging into. And so we're trying to support things along those lines to ensure that they're able to sustain throughout this time.
Thanks. There's so many things, and we are really a big foundation. So I can speak about some things I'm not super involved with, but we do a lot of sort of upstream democracy funding. We're involved in a lot of different kinds of litigation support. We participate in some amicus briefs. We fund a lot of people that analyze litigation and, sort of brief grantees on what's going on and, what are some opportunities. We are doing some things to help some of our grantee organizations protect themselves, against different kinds of threats. But as others have said, we cannot fill the holes that are left by, reductions in federal funding for sure. One thing that I'm super engaged in is coverage, because that's kind of my thing. And we're facing this massive threat to coverage, both from Medicaid and the ACA. So we're following the reconciliation bill very, very closely, and we have major investments in the production of credible estimates of what the impact will be, different outcomes. So we've run the Urban Institute, which has a very good simulation model, and they're able to quickly, produce a lot of estimates of the, the impacts and different policy proposals. And then we run a lot of advocates, to transmit that information in different ways into different places so that it can get used, so that where it's all C3 activity, of course, though everybody understands, what would be the impact in terms of coverage. And then, we're able to talk about what happens in the community when a lot of coverage, what happens in the left in coverage, which you're seeing happen reverse, and seeing, all the things we're facing, like health systems like this, so, I'd say we're, full speed ahead on coverage stuff because the threat is so huge. But we're also really concerned about and interested in data that's not necessarily available anymore, may not be available. We're really watching the breakpoint stuff and seeing, what's going to happen there, sort of regardless of what the Supreme Court does. It's going to be some kind of adventure, and that's something that we're very interested in. We're pretty interested in the census, even though it seems like it's a long time from now. We're we definitely, that you have to work on the census every year before you get to 2030. So that's another place what we're trying to see. How, I think I'm sure a lot of my colleagues would say different things will big, but people are working on housing and lots and lots of other things.
All right,
So
so
do we have time for a few questions?
Hi, thank you for the information. The question, I think, primarily towards Heather with regards to senior services, but others can chime in. I've heard a lot and read about the benefits of home health and care delivered in home in varieties of ways. And I was just curious whether that was a priority that any of the foundations are looking at in terms of things that can improve the delivery.
Unrelated to HSX, yes, that's something that we think about a lot. Site of care and appropriate place of setting, level of care, and certainly from a workforce perspective as well. It's not something that we're actively investing in, but I think there is some of what the work that we're doing with HSX that will lead us to potentially engaging caregivers and home health as part of the expanded model. I don't want to speak for them, but I know we've.
No, I think that's right, John. That's part of where we're headed, and thinking that our data and what we could wrap around services to that patient, a lot of it can be delivered in the home and care for them. So yes, I agree.
So I just want to add one thing. So I'm the co-chair of the Pennsylvania Health Funders Collaborative, and we're very active in home care, in senior living from a policy and systems perspective, and thinking about long-term services and supports, and how can we influence and support policies to make the access and quality even better for individuals. So that's a group of 30 foundations across the state. I will say that the Jewish Healthcare Foundation is in Pittsburgh, is actually the lead on that. But, there is a group of foundations around the state that's really working on that.
Hi, I'm Shannon Isaacs. I'm the executive director of the Montco Anti-Hunger Network. I was wondering if you've seen done well. I think of social determinants of health data being very segmented by topic. So the food data is separated from the education data, is separated from the healthcare data, and they're very siloed. Have you seen done well, and what did that look like? An integration of data-driven social determinants of health, impact work, and data work.
I'll say, personally, I haven't seen it done well, but that doesn't mean it's not being done well. I think where we've seen it being used in that way has really been at the provider level in terms of our CDOs, and some of them being able to create dashboards that are pulling different data sets in to be able for them to understand that work. I'd say, I know a little bit, I know less about what's happening sort of more broadly at Pew related to that, but just locally, that's where I've seen most of the innovation happening.
Any other question? That's a great question. I think we're maybe additive to that, but we're still working towards making that data more prevalent and all available in one place. But I don't know, I don't want to put you on the spot. But there are some New York HIEs that are doing some interesting work in the space.
Yeah, and our HIE in Buffalo, they combined with their Regional Health Improvement Collaborative, and so the two together are better equipped to look at social factor data and how those can be combined.
Hello, Ronan Gannon, CEO, LCH Health Community Services. I know we're early on in this kind of uncertainty, but have you seen any experiments that are going on right now that either look promising or have delivered any results that would help us figure out how to move forward? When it looks like Medicaid is going to fall to pieces potentially, and lots of other funding sources are evolving as we go. So are you seeing any of your agencies doing some really creative things that we should be looking at, whether it's scenario planning or anything else, that would help us also say, yeah, maybe we can adopt those ideas as well?
I'll say some of our local growth grantees have are doing some innovations related to becoming less reliant on being reimbursed. So one of our organizations is actually in the process of developing their own pharmacy that will allow them. So is that you? Okay. Yeah. So that's just one example that we've seen locally. But again, I think it's still early on, and I imagine we'll see more of that. I think through the scenario planning process, a lot of organizations what we're trying to do is help them build the muscle to really think in that way. So I think as we move forward, we will see more of that.
And I know your organization well, and you all are an amazing partner. I just want to give a shout out to LCH for being one of the first FQHCs in our state actually to receive NCQA Health Equity Accreditation. It's an incredible achievement of theirs. And why do I say that? Because plans and health systems sort of do that, and they have giant teams of people who can, make that possible and achieve the standardization. It's not that common among health centers. And why does that matter? Not for scenario planning, but more so for partnership opportunity. Making sure that, we're leveling up the provider network that is going to be most disadvantaged if and when there are changes to entitlement programs. Now, luckily, health centers tend to operate on funding that's not part of entitlement programs, but they will be directly impacted if those entitlement programs are indeed, cut or modified in significant ways. So I think things like that are good examples of where action needs to happen, just to be prepared for better and more stronger partnerships.
And just to add to that, I think one other piece that we're seeing is that we're trying to get organizations to think about is the idea that mergers and acquisitions can be a good thing. Traditionally in the business world, that is the case, but in the nonprofit world, there is still a lot of concern around what that means for people's workforces and the impact that will have on communities. And so we're trying to really socialize the idea that mergers and acquisitions, particularly during this time, actually might be an okay thing. And that what's important is that the services continue to the communities.
I would say we're more focused on trying to prevent some of these things still, but when and if things happen, we'll also be interested in the implications of our delivery.
Philanthropy. I'm looking at my colleague Joe Pyle over here. I know that there's a group of foundations that have come together in Philadelphia to talk about what does a pool fund look like, what does a coordinated project around scenario planning, what do nonprofits need, whether it's legal representation, whether it's accounting, to talk about business planning, right? And to Meredith's point, like having those services at their desire to then figure out what their future is. Because a lot of nonprofits are funded, receive federal funding. And that's certainly uncertain right now. So philanthropy has come together to talk about as quickly as we possibly can. And I think that's a key. How do we support nonprofits immediately? And quite frankly, the nonprofits have said to all of us, like, where's philanthropy in all of this? And I think we are there. We're just not as visible as I think the community-based organizations would want us to be. So that is continuing and rapid speed.